Starting.
Good afternoon, everyone. My name is Bailey Taylor, and today I'd like to talk to y'all about skin cancer. As you can see, skin cancer is something that is skin deep, but is also a very scary topic. By the end of the day, I want everyone to feel like they've learned something new. My goal is to supply you with information about the types and symptoms of skin cancer, as well as how skin cancer is diagnosed and treated. To end my presentation, I will discuss prevention methods and what the next steps are if you have any further concerns or questions. Let's get started. First thing first, I want you to ask yourself, is that golden tan really worth it? The tan may fade, but the damage done can last a lifetime. Here are some startling facts that may change your mind about the need for a healthy glow. Skin cancer is the most common, Skin cancer is the most common form of cancer in the United States. There are over 2 million new cases each year. Each year there are more new cases of skin cancer than the combination of breast, lung, prostate, and colon cancer. And lastly, 1 in 5 Americans will develop skin cancer within their lifetime. There are 3 basic types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. As the name suggests, basal cell carcinoma begins in the basal cell layer of the skin. It's most common in people with fair skin and is found in places that are exposed to the sun on a daily basis, like the face. Again, the name gives it away. Squamous cell carcinoma begins in the squamous cells. It is most common among people with dark skin, and it is usually found on places that are not exposed to the sun on a daily basis, like the legs and feet. The third type of skin cancer is melanoma. Melanoma begins in the pigment cells. This is the most dangerous form of skin cancer, and it can form on any skin surface. Now that you know about the types of skin cancer, let's talk about some of the symptoms. Basal cell and squamous cell carcinoma exhibit many similar symptoms. Here's 5 warning signs that are associated with these types of cancers. If you have a lump that is small, smooth, shiny, pale, or waxy, a lump that is firm and red, a sore or lump that bleeds or develops a crust or scab, a red or brown patch that is rough and scaly, or a flat red spot that is rough, dry, or scaly, and it may become itchy or tender. Those are signs of basal cell and squamous cell, so if you see any of those, you might need to talk to your doctor. As far as symptoms of melanoma, they are different than the other two. There's a really easy way to remember the identifying factors of melanoma. Just think A, B, C, D, E. A is for asymmetry, so if you can draw a line through the mole and it's not even on both sides, it's probably questionable. Border. In the early stages, melanoma has an irregular border and it's uneven. C, color. Healthy moles are a uniform color, while melanoma exhibits a variety of colors. D for diameter. Rule of thumb is that a melanoma will be larger than a pencil eraser in diameter, but it can be smaller. E is for evolving. Basically, if you notice any signs of change in a mole, it can become questionable. Now that you know some of the symptoms, let's talk about how it's diagnosed and treated. In order to confirm a case of skin cancer, a dermatologist will have to perform a skin biopsy. If this indicates skin cancer, treatment will begin. Sometimes the entire cancerous area is removed during the biopsy, but if it's not, surgery is usually the next action. All treatment plans depend on the type, size, and stage of the cancer. Most importantly, let's talk about prevention methods. There are many ways to lower your risk of skin cancer, and these are some of the most commonly advised methods. First thing, seek shade between 10 a.m. and 4 p.m. This is when the sun rays are the hottest and you're most likely to get a sunburn. Number 2, don't burn. Every sunburn you get increases the risk of developing melanoma. Number 3, avoid tanning and UV tanning beds. Tanning beds give off 12 times the UV rays that the sun does, so that's just asking for trouble. Next, you should cover up with clothing. This is mainly talking about hats and sunglasses, because we know you're not going to wear long sleeve shirts out in the summer, but try to protect the sensitive areas of skin, such as your face. Also, you should use sunscreen with an SPF of 15 or higher every day. An SPF of 15 will filter out 93% of UVB rays, and if you use a higher SPF, it will have a higher percentage of filtering out the UVB rays. Also, you should apply sunscreen to your entire body 30 minutes before going outside, and you need to reapply after every 2 hours. Don't depend on the sunscreen you used at 9 a.m. at 4 p.m. in the afternoon, because it's not going to be any good anymore. You should also examine your skin thoroughly every month. You know your body better than anyone, and so you'll be the first to notice if something weird appears. Lastly, you should keep your eyes open for any skin changes. Refer back to the warning signs we talked about and set an appointment with a dermatologist if you see anything out of the ordinary. After gathering all this information, I encourage you all to go on a mole hunt and set up an appointment with the local dermatologist for a professional skin cancer exam if you see anything strange. In addition, if you're concerned about any moles you have found, there's an app for that. This app's called Spot Check, and it's free for iPhone users. Basically, what it lets you do is you take a picture of a mole that you're kind of questioning, maybe not so sure about, and then you send it off, and within 24 hours, a certified dermatologist will get back with an answer, and they'll let you know if they think it's questionable and you need to come in for an in-office visit. I have also included a list of websites that I consulted for my information. If you have any questions about the types, symptoms, diagnosis, treatment, and prevention of skin cancer, these are your go-to sources. Thank you all for your attentiveness. To close, I encourage you all to commit to the prevention methods, and remember that beauty is skin deep, but so is skin cancer. Do you still think it's worth it? Think again. Woo. Okay, I don't know if you should scan the room again, just to make sure. Yay.